We have another call. Good afternoon to you. This is NewsSpin. You are on the air.
Hi, Tim. Alan Chastanet
Hi.
here. How are you?
Yes, I'm okay. Good afternoon to you, Mr. Shastny.
Very, very good. I'm very glad I was able to get through today.
Mm.
Tim, we've heard a lot about healthcare, and I think that probably one of the most damning observations that's been made is that you have in Castries East, the representative is the Prime Minister. You have in Castries South, the Deputy Prime Minister. You have in Castries North, the Senior Minister. And you have in Castries Central, some people say, the one to be Prime Minister. So here it is, you have four, I would say, to the most senior people in cabinet. And you have a common situation for all of them. The fact is that the healthcare center in Leclerc is dysfunctional. The healthcare center on the Chaussee has not been functioning for a while. The Marsha Healthcare Center has been closed. The Entrepot Healthcare Center is only on a part-time basis. And then in Castries South, the only real functioning healthcare center, if I'm not mistaken, is in Marigot. Now, this is a significant part of the population, Tim, which all of them now have found themselves in the same situation. All of the constituents, whether they are Labour, whether they are Flabo, whether they're independent, now have become exclusively dependent on OKEU to be their healthcare center. Imagine that. We saw the letter, we all saw it with our very eyes, and many people have quoted from it, the letter from the Medical and Dental Association, that back in July 31st, that they had reached a point of frustration where the doctors said it's never been worse. And they went on to really describe a horrendous situation taking place at OKU, and one in which they said people had already resigned, and back in July of 31st of this year, had warned that there were going to be more resignations, which we have already seen. We're hearing situations of people having to wait in the emergency center, wait for entry, can't get a bed, and when they do get a bed, there's not enough equipment, bed sheets, and medication for them. All of that is in the letter since July 31st, and my understanding is that it's gotten worse. So if you're telling me that four of the most senior ministers, Prime Minister, Deputy Prime Minister, Senior Minister, and one to be Prime Minister, that none of them have been able to do anything, none of them have been able to put any sense of urgency to resolving the issue. And then to make matters worse, we're hearing about the Babonneau Healthcare Center and other healthcare centers throughout the length and breadth of the country that are being closed. At this point, and the Minister of Health, the Prime Minister, the Deputy Prime Minister, the Senior Minister, and the one-to-be Prime Minister, all whose constituents are suffering and are being exposed, their health. So if you have a basic health problem, you can't go to a healthcare center in your constituency. You have to go and take a line where you're dealing with patients from around the country, persons who have been shot, persons who have been in car accidents. This is absolutely unacceptable, and that's why I say to the people of St. Lucia, the time has come for us to right the wrong. Cannot sit idly by and continue to watch what's going on, because it's disrespectful. If those four gentlemen cannot find the time, I mean, the same person who wants to be the Prime Minister has a show every Thursday. You'd have thought an hour and a half, being the district rep of Castries Central, a person who says he cares so much, would have spent his hour and a half explaining to the people in his constituency and all the other constituencies in the Castries Basin how this problem is going to be resolved.